Imagine walking into a room where 3 different instruments are playing. One is a soft violin, barely noticeable. Another is a trumpet that demands a bit more attention. And then there's a drum, loud and impossible to ignore. This is how anxiety, hyperarousal, and agitation can present in our lives. Each requires a different touch, a different understanding, and a distinctly tailored approach to soothe. Stick around as we dive deep into these emotional states and try to understand why they're not all just anxiety. It's crucial to recognize the difference between these 3 because this can make a big difference to treatment and recovery. Welcome to Psychiatry Simplified. I'm Dr. Sanil Rege, consultant psychiatrist, and today we're going to embark on an exploration of the emotional responses that we often lump together as anxiety. But there's a world of difference between anxiety, hyperarousal, and agitation. So let's start with the basics and work our way through this complex terrain. Many of you have sent comments where you've highlighted how an SSRI or an SNRI was prescribed, and this resulted in really significant side effects, elevated anxiety, even akathisia. It's in situations like this where it becomes important to differentiate between anxiety, hyperarousal, and agitation. You see, the stress response is mediated through the amygdala. It's what we call the fight and flight response. Fight and flight response moves through different stages. So it begins with fight, can move towards fright, and all the way towards what's known as flag and faint. The expression of this fight and flight response lies on a hierarchy of emotions. And those 3 emotions is what I'm going to take you through. So let's start off with the first one, anxiety. Anxiety is like an undercurrent. It's always there and pulls at your attention with what's known as worries. And those worries can be about several things: relationship, work, children, in some cases about social situations, which we call social anxiety. Anxiety is characterized by persistent thoughts known as preoccupations, and these are worries about the future. Along with these worries comes the tendency to avoid certain situations, particularly situations that might trigger this anxiety. Patients may experience physical symptoms such as a racing heartbeat, mild insomnia, neck tension, butterflies in the stomach. Individuals can control these thoughts. So when I ask patients the question, are there times when you can distract yourself from these worries? And they often are able to say, I prefer going to work because I can focus on work and I don't have to think about all those other worries I have at home. You can see here the prefrontal cortex is able to control the arousal network, the amygdala. So here, these preoccupations do not become all-consuming. Individuals can actually overshadow it with tasks and activities. However, when the stress response continues unabated, we enter into the next level, which is hyperarousal. So what is hyperarousal? Now remember, we talked about anxiety as an undercurrent. Now imagine this undercurrent swelling up and growing into a surge. That's hyperarousal. Here, along with the worries and preoccupations and some of the physical symptoms, there is a worsening of symptoms. The preoccupations become harder to control. Sleep is significantly disrupted. Individuals experience vivid dreams or nightmares, or even night sweats. They wake up several times in the middle of the night. Individuals may say things like, I feel like I haven't slept at all. And what this does, it leaves the person on edge the next day because we need restful REM sleep in order to function adequately from an emotional perspective the next day. So what that does is hyperarousal results in a heightened emotional tone the following day. So what's happening neurobiologically? Neurobiologically, the prefrontal cortex is losing its battle with the amygdala. The amygdala is now overactive. It's like the volume knob has been turned on excessively to full volume. Individuals may startle more easily, what's known as hypervigilance, feel their pulse quicken. Even during calm moments, individuals feel like they just can't relax. They describe it as feeling wound up or feeling really tense or tight. They experience muscular aches that are constant. Some individuals may experience migraines as a result, or a tension headache. This isn't just anxiety. This is your body on high alert, what we call hyperarousal. Now imagine the stress response continuing, the hyperarousal not abating. This is where we enter into the next phase, which is agitation. At the peak of the arousal spectrum is agitation, which is a very very uncomfortable feeling and is extremely distressing. Agitation can be associated with a high risk of suicide. Here, the arousal is no longer just an emotional response. There is now a significant physical component to it. So the drum is now at the forefront and it's relentless. The individual can't stop the constant drumming, and the drumming is really, really loud. The individual can't control it. One can't overshadow it with work or tasks. And you can see how this can move towards a pathway of reward deficit where the individual enters into depression. Family members might say they're pacing all night. They're constantly wringing their hand. You can see them in the room extremely restless. Sleep doesn't offer respite. So individuals not only have difficulty falling asleep, staying asleep, but they also wake up earlier than usual. Patients describe it as feeling wired when they wake up. I've had descriptions like, it's like a SWAT team that arrives at the door every time I wake up. During the day, the patient is on edge. The thoughts are racing, patient feels restless and can't control it. So one can see what began as anxiety, as the stress response continued, it moved towards hyperarousal and then towards the most extreme form, which is agitation. Now, why is this important? When it comes to diagnosis and treatment, recognizing which instrument is playing the loudest and is affecting the person's life is crucial, because the treatment for a soft violin is different compared to the treatment for a blaring trumpet or a thundering drum. Specifically in terms of biological and psychological treatments, this becomes important because SSRIs are evidence-based in the treatment of anxiety. However, in the context of hyperarousal and agitation, SSRIs or many other antidepressants can worsen the hyperarousal and agitation. And this is the reason why patients can experience significant panic attacks, or their jaw clenching, or a worsening of migraines. Patients say things like, my legs became really jumpy, my nightmares have worsened, I can't sit still. In some cases, this leads to akathisia, and you can see this is where the distress becomes very, very significant and difficult to control. Thus, the choice of medication becomes extremely important at this stage. Hyperarousal is mediated by noradrenergic potentiation, and we know that because of the presence of vivid dreams and nightmares. This occurs in REM sleep. The milieu of REM sleep is noradrenergic timeout or noradrenergic silencing. And we know that when we target this through appropriate medications such as alpha-2 agonists or alpha-1 antagonists, prazosin or clonidine, it can be a significant improvement for patients. Thus, differentiating between anxiety and hyperarousal here can make a big difference to the patient. Don't forget to check out the videos that we've already done on alpha-2 agonists, prazosin, clonidine, and guanfacine as well. When it comes to agitation, however, we need to be even more proactive. This includes agents at the top end of the spectrum to reduce mesolimbic activation. Now, this depends on whether the person has agitated depression or elements of psychosis, and this requires medical supervision. When it comes to psychotherapy, Damasio describes psychotherapists as amygdala whisperers. However, as clinicians, we've got to recognize when the amygdala is screaming back, and whispering is no longer going to work. And that's where the biological elements become important. But the choice of biological elements becomes even more important, as if we prescribe certain medications for hyperarousal and agitation, such as SSRIs or SNRIs, we can make the situation worse. This is why, as clinicians, we must carry out a detailed diagnostic assessment and differentiate between anxiety, hyperarousal, and agitation. For individuals, understanding the spectrum may be extremely life-changing for them. Understanding that the SSRI is evidence-based in anxiety, which means it might calm the violin, but could make the drum beat harder, makes a big difference overall to their lives. It can help individuals articulate to the clinicians what they're experiencing, so that they can receive targeted treatment. To summarize, remember that these emotional states can be differentiated, and they're also treatable when the right treatment is applied to the right emotional state. I hope that you found this video useful. If you liked it, please don't forget to leave us a like, leave us any comments or your personal experiences as well. Thank you so much for watching, and I really appreciate your support for this channel. I look forward to seeing you in another video soon. Until then, stay curious.